Yeah, bunch of dudes on the car.
Good morning. This is Erin with the Department of Medicaid. It is not quite 9 o'clock and we're still clearing the waiting room, so we'll give it just a few minutes before we get started.
Thank you, Mayor.
Steve, it's officially 9 o'clock, but we are still clearing the waiting room if you'd like to wait a moment longer.
Yeah,
So far, I see yourself, Adrian, Van, Casey, Brandon, Angela logged in. Did I miss any TAC members?
I have 6 as well.
Okay. Sometimes when they come in big bulk, I sometimes miss someone. They sneak in on me.
That's not.
Steve, excuse me, the waiting room is cleared. If you'd like to begin, I believe you need one more for a quorum, so I can keep an eye
Right.
out.
That's my now. Sure. All right, thank you. This is the reentry TAC, much shorter name now. Appreciate y'all being here. See the agenda on the screen before you. And thanks for the TAC members being here. And we have 6, we need 7 for a quorum. So what we'll do is we'll wait on the minutes till we have a quorum, and then we'll jump up and take action on those. So let's go ahead with the Medicaid update. And I saw Angela Sparrow on. She's going to give it today.
Good morning, Steve and everyone. Yes, I'll go ahead and give updates for Medicaid in terms of where we're at on the reentry 1115 implementation and CAI implementation. So good to see everybody this morning. It's hard to believe we are well into May. So there's lots of things going on, lots to do again. As we continue to move forward towards implementation of the reentry 1115. So to give you some updates again on where we are, we've really again been focusing a lot on system requirements and changes to support implementation. There are lots of systems and IT systems that are going to be impacted again to be able to support identification of individuals, be able to allow for eligibility through the pre-release time period, the services, again, very targeted set of services, and then be able to, again, support the full reinstatement of benefits at the time that the individual is released. So we have been working on identifying system changes to the eligibility system, our IES system. Again, to do specifically what we mentioned, being able to identify the individuals. So again, it's the program is really facility based. As you all know, we've talked about certain facilities and locations. So how do we identify what facility the system needs to be able to assign eligibility for individuals in DOC prisons, for our youth and our youth development centers. We've talked a little bit again, there are a couple of authorities that will be in place. So the 1115 and CAA. There's some differences in those timeframes of when services can be provided. There's some differences in who's eligible for services, and there's differences in what services are available. So the system again will kind of really need to be able to identify 3 different populations, if you will. So we need to identify those that are going to be eligible for just the reentry 1115 services. We need to be able to identify those that are eligible for reentry and CAA services, and then those that are just eligible for CAA services. So we've been, again, working through that and how our systems will be able to determine eligibility and be able to assign the appropriate eligibility. How can we communicate that to our correctional partners? How can we communicate that to our NCOs? So how can we, again, ensure that they are receiving those services as soon as possible? So looking at those eligibility changes. With that being said, there's also MMIS changes, so our billing system to allow for those services by the appropriate providers in the appropriate window. Again, we also don't want to cause confusion for community providers in terms of, the individual is still incarcerated. So again, all of those things that feed over to our MMIS system, looking at those changes as well. And then DOC and DJJ having some discussion with our correctional partners in terms of some of the system changes that they'll need to make. So again, there will be some new information that they'll need to be able to identify in their systems to support delivering services to the individuals, being able to bill for services. So they also, again, will have to make some system changes. They're again working with their vendors to do so and work through that as well. There's going to be some med impact changes. So our pharmacy, right? There are going to be some system changes there for our pharmacy services, the 30-day supply at the time the individual's released. So we're working through what that looks like. And then I know we've talked about KHI as well. So again, KHI as a platform to be able to really be leveraged to support that warm handoff between the correctional partners and the MCO to support that case management service. So again, we are also looking at and working through what that looks like for our correctional partners, which I think DJJ is already participating and has some of that infrastructure there to support some of that integration with KHI. So those discussions are occurring as well. With all of that being said, there's potentially some changes to the information that we share with the MCOs. So they're going to have some system changes, right, that needs to occur to be in place to support implementation as well. So lots of system IT work. And again, really trying to wrap up those requirements so we can work on deploying those changes through the summer timeframe. We also, again, have ongoing work groups. So continue to meet with DOC and DJJ weekly. Again, that's really one of those avenues for us to work through some of those requirements and changes. Still, again, having some ongoing pharmacy discussion in terms of changes to support the allowing Medicaid again to reimburse for that 30-day supply at release. Again, integrating and aligning with the Medicaid PDL formulary for DOC and DJJ. So some of that work, again, continues to be ongoing. Around finance, again, there are some discussions and some work going on there in terms of the pre-release services that will be paid through the managed care. So again, excuse me, there will be some new rate cells that will have to be developed to support that pre-release package of benefits and services. So again, working with finance around that, with the actuaries, and then with the MCOs to support that. Also working with the MCOs on developing the case management policy to support, again, pre and post-release case management services. So what does that look like? Again, getting some feedback from MCOs, from DOC and DJJ, again, in terms of what their current policies are to support that integration and, again, collaboration with the MCOs. And we'll be pulling those groups together to have some of those final policy decisions around case management. And then we will start to kick off the MAC discussion and work group when we wrap up some of these other topics. Again, we do continue to work with DOC and DJJ in terms of enrolling as providers in Medicaid. So I think we've talked about, again, there is a new provider type that's been created for our partners to enroll. So we know, again, that process is can take some time. So we're working with them on that, and we'll actually be getting them enrolled and then contracting with the MCOs. So that will be required as well. So that work, again, will continue to occur through the next quarter and two. We, again, will then start to move towards the summer next quarter in readiness assessment when we start to deploy some of these system changes, again, some of that testing. So lots of things, lots of parts going on. We did receive some feedback. I'm not sure if we mentioned from CMS on the evaluation design. So I know I think most of you have heard us talk about Mercer, who's the independent evaluator of the Reentry 1115, and who has drafted that evaluation design. So Mercer is reviewing that feedback from CMS and is on target to submit that back to them next month as required. So nothing, again, significant there in terms of feedback that would change the evaluation design. Have not heard anything back from CMS on our monitoring or implementation plan that we submitted last fall. We have heard some discussion that CMS may be releasing some guidance to states in terms of monitoring protocols, metrics around the reentry demonstration, very much like they do for other waivers, such as the substance use disorder or the severe mental illness 1115. We are thinking that may be possible that they release that this summer. So that may be part of why we haven't heard some feedback from them on our monitoring protocol, that they're working on really streamlining across states specific metrics to monitor the reentry 1115. So I know that's a lot there, but I'll pause before we talk about CAA if you have any reentry 1115 questions.
Any questions, folks? Will it's a delay, but the update on the monitoring implementation plan, will that delay the start date?
No, it will not. Good question, Steve. So it's a little different. So all of the 1115s and requirements have been a little bit different. There are some that do require approvals from implementation plans before states can implement. Reentry does not require that implementation plan approval before we can implement. So we will be able to move forward with that without that approval. So there was some change in our standard terms and condition language that was issued with the December 2024 approval, that again, we can move forward. So.
And that start date, it was October 1, is it January 1 now, maybe?
We're still targeting 10/1 when we wrap up some of these system requirements. That's going to give us a little better idea, and we hope again to do that, have that completed by the end of the month. And some of that final analysis, some feedback from our vendors and what that timeline looks like. So we'll know a little bit more if there's any change to that.
And you had mentioned provider enrollment, a new provider type. What is that new provider type?
Reentry organizations. I think
Okay.
it's I think it's provider type 53 reentry organizations. So that is a new provider type that we created. Initially it will be DOC and DJJ, but any of the jails that might enroll with CAA implementation. But again, the jail model may look a little bit differently, but again, would be able to support that as well.
That's to build a 60-day pre-release services.
That's right. Correct.
Because once they get out, there'll be someone else doing that stuff.
Right. Yep.
Thanks.
So for
So
CAA, go
Yeah.
ahead. Sorry.
Oh, that's good. Good information. Go ahead.
In terms of CAA, the Consolidations Appropriations Act that went into effect January 1st, we continue again we've wrapped up, I think we've mentioned in previous calls, the engagement with the jails, the local jails across the state. So we've wrapped up those one-on-one interviews. So again, we had that initial survey at the beginning of the year. Based on that survey, we did one-on-one interviews with the jails to help give us a little bit more clarity in some of that information that we obtained in the survey, to hear a little bit more, get a little bit more details and ideas from the jails in terms of the services that they're currently provided, how they're providing those services, and again, where they may be best situated to onboard for CAA, where there's some of those needs. So based on those one-on-one interviews, again, over the next couple of weeks, we'll take a look at that in terms of grouping, if you will, what jails might be best situated to come on board through that first cohort. So again, potentially looking at a handful of those jails to be in that first cohort to bring on board, hoping to do that in line with the 1115 implementation. But the next steps with that cohort would be to really kind of get even further in the weeds, if you will, in details, and aligning, we have the CAA requirements, of course, we have Medicaid requirements, and then ensuring, if the practitioners that are providing services online, et cetera, if they don't, how can we support them getting to that point, and kind of building out what that onboarding plan looks like. I think we probably had, and I don't have the numbers, we'll certainly can provide it in the next TAC, or again, for those that are on Acres call. I think we had around 20 jails that we interviewed. And then again, the second cohort would kind of launch more towards probably 2026. We've been, again, still in communication with CMS around the CAA SPAL amendment. We have received another round of questions from CMS. There, again, we're not alarmed regarding the SPAL being approved, anything like that. This is just, a new SPAL, new services, new approach. So what they're also, again, developing is a companion letter. So this companion letter would be different than, what we typically would get with a SPAL approval. So all of the states would receive a companion letter for those states that are kind of more in that partially ready to implement CAA requirements. But that companion letter will outline what the state needs to do to come into full compliance, as well as the timeline that the state has to do so. So again, CMS on their side still has some of those key decisions to make within, with their leadership as well, in terms of what that timeline looks like, if it will be individualized for states or whether it may just be across the board for all states. So that we don't know yet, but they're working on that, and hopefully in the next few weeks, we'll have a better idea of that. So that will, again, the SPA would be approved, but it would be a little bit different than what we would typically see. This companion letter would outline what we would need to do and when we would need to have that, those items again in place to be in full compliance. So we
And
continue.
the first cohort, is that 20 jails?
The first cohort is probably going to be more about a handful of jails.
Okay.
Again, really to be able to help us kind of pave the way, if you will, right?
Yeah.
And see, again, it's not something that we can be able to bring them all on board at once. So, but I think that's all I have. If you all have any questions.
Any questions, folks?
Steve, before we move on, Nathan has joined us. You now have a quorum.
All right, let's jump up and do the minutes real quick. I sent those out. Do we have a motion for the minutes?
So moved.
Thank you, Van Ingram. Do we have a second?
Second, Brandon Harley.
Thank you, Brandon. All in favor, signify by saying aye.
Aye.
Opposed and abstentions. All right, good. We can report we got a quorum. Okay, thank you. And no updates on Hep C. Still working on that. It's okay.
Steve, did you receive the data I sent out to you guys?
Yes, I did.
Okay.
Yeah, good. All right. Well, let's go on to MCO updates. Edna?
Hey, good morning. This is Courtney Ham from Aetna. I don't think we have any updates, but I want to see maybe if Lana had jumped on. I don't think she has, but we don't have any updates. We're just still working on everything that we're supposed to be working on. So that's our update.
Okay, thanks. Humana?
Good morning, everyone. I would just like to share a few important updates on behalf of Humana regarding our reentry program. As of today, we have not received any newly released members since the beginning of March, which is actually quite unusual for us. And in terms of our community engagement team, they have been actively participating in various events across the state to support reentry initiatives. Recently, they conducted outreach at Kentucky State Reformatory on April 21st and Kentucky Correctional Institute for Women on April 25th. Additional outreach events are scheduled for May 19th and 23rd at both of these institutions. On May 2nd, they also participated in the Care Connect Job Fair in Newport. Furthermore, today they are set to attend two significant events at the Sterling Crossroads Expungement Clinic in Mount Sterling and an outreach session at the LaRue County Detention Center. So that is all we have for Humana. Thank you, and I look forward to sharing again at the next TAC.
Thank you, appreciate it. Passport.
Yes, this is Priscilla Schwartz filling in for Mark Zackham today. We continue to do our engagement and serving on reentry councils, resource fairs, and expungements across the state. During the Q2, we have 16 events either completed or planned already. And some of those highlights is on April the 10th, we participated in the expungement in Perry County with the physical court. On April the 18th was at the Muhlenberg Greenville pre-release class. On April the 22nd, we hosted an expungement fair here at the Bowling Green One Stop. On April the 25th, we were at the Kentucky Correction Institute for Women, their pre-release class event. On April the 25th, we attended the Warren County Jail pre-release class event. On May the 2nd, we helped host the McCrory County expungement event. And we have on June the 17th, Owensboro One Stop Help Center, an expungement event there. And on June the 26th, we have a Hazard One Stop expungement event there in Perry County. And for Q3, we have 10 events planned already, and Q4, we have 7 events planned. Thank you.
Super. United.
Hi, good morning, Steve. Stephanie Koenig. Update from United Healthcare. We have really focused this year on our partnership with Goodwill Industries. We did add that as a value-added benefit for our members. So we've had monthly expungement clinics since the beginning of the year. Our utilization with Goodwill expungement, we had 2 in January, 6 members in February, 2 in March, and 4 in April. Through this process, Goodwill also offers job training, career coaching. So it's a partnership from the expungement into kind of connecting, hopefully, to meaningful employment. We've also, with our enhanced monthly reporting, have done monthly outreach since August of 2023. And so, Steve, we've in total been able to outreach 1,247 individuals that have been released from incarceration. We've been able to successfully engage with 220 of those members, and 105 have agreed to case management. So we continue those efforts through the eligibility file that we receive each month. We also have a partnership with community health fairs with Groups Recover Together and VOA. So Goodwill and Apple Red are at those at those community health fairs, offering those services that Goodwill, with our partnership with Goodwill. And that is where we are this month. We have also not received any referrals. Our efforts have been solely just through our enhanced internal reporting to identify those that have been released and do those outreaches.
Super, thank you.
You're welcome.
WellCare.
Good morning to you, Steve. Yeah, regarding referrals as well, we have not received any reentry referrals since March. Also, the volume has usually been pretty low. I think it picked up from January and February, but nothing since March. We've got work groups. Kind of the big focus is what the initiative that Angela, gave everybody an overview of earlier, the reentry demonstration waiver. So we've got work groups, and it's a big operational lift. So that's kind of been the focus so far, and will continue to be. But otherwise, we don't have any other updates.
Okay. Stuart. Appreciate that. Angela, are you still on? I just thought of a question.
I am, yes.
Okay. Has federal action impacted the reentry waiver that you know of? We're all hearing, the monster in the closet under the bed is what happens at the federal level.
We have not received any notices, any other, changes, any reason to believe that there'd be any impacts to the reentry 1115 waiver.
Okay, good. We're moving quickly. Next month, we'll take a deep dive into that Hep C data, and we'll make sure everyone has that and go from there. So that's the plan for next month. All right, round robin update, members. Have you heard any federal concerns or anything that you think is worth sharing? Anyone
Steve,
else?
speaking of Goodwill, I'm here at the Goodwill Opportunity Center in Somerset, where we're having a Fair Chance Academy today. This past Tuesday and the previous Thursday, the governor made announcements about overdose deaths declining by more than 30% from 23 to 24. This is our third year in a row of overdose deaths going down. I think the work that we've all been doing is bearing fruit. And although we're really pleased that 500 families did not have to go through the tragedy of an overdose, there were still 1,400 families that did. So we've still got lots of work to do, but I think the progress is there, and we're going to get we're going to get there.
Yeah, that was great news, wasn't it?
It really was.
Someone said all that Narcan's been passed out, paying dividends.
That and so many other things that have happened
Yeah.
in every corner of the state.
Yeah, yeah. And we appreciate your leadership on that, man. So. Any other members? I'm glad you're summer at Goodwill. I opened the first services in Goodwill in Somerset in 1992. So,
You were ahead of the curve, Steve.
and I was doing what I was told. So, every now and again, I try to do that just to keep myself, on the right side. If nothing else, folks, we're done. I'm not gonna waste your time. I'll give you back 30 minutes.
Hello, Steve.
Yeah. Jonathan Scott, how are you, sir?
Doing good. How are you? I do have a presentation about our restructuring of the Medicaid Advisory Committee, if you would be interested in that.
Yes. Tell us about that.
Yep. All right. If it's all right, I'm going to share my screen. We have a little presentation for you.
Super. Thank you, Jonathan.
All right.
Jonathan, you should be a co-host.
All right.
He should be.
All right. Here we go. Can you all see that? No, you can't.
Not yet.
I bet you can now. Maybe.
We're getting there.
How's that look?
There we go. Yeah, we got
All
it.
right. Well, can you see that?
Yes, we do.
All right. All right. This is our we have new federal requirements for a Medicaid Advisory Committee and a Beneficiary Advisory Council. Wanted to talk about how the MAC is going to be restructured into it's going to have the same members that it does now. The advising role is going to be the same. We are expanding our membership to managed care organizations. So there'll be one appointed member from the managed care organizations. And then the federal rule also requires that a certain percentage of the MAC be composed of members of our new Beneficiary Advisory Council. So we're going to add, I believe, 7 to 8 members from that committee will be joining the new MAC. The name of the MAC is also going to change from the Advisory Council on Medical Assistance, which for some reason we call the MAC anyway.
Yeah.
So the new term will actually be the Medicaid Advisory Committee. So we will actually be using that acronym to mean the same thing that we've been using thus far. The selection process is going to be very similar, where folks will continue to be nominated by an organization, but the members will now be selected by the commissioner. So that process will be that'll be the only switch to that. Still going to be nominated by your nominating body. The information will be submitted to DMS, and we'll go through that same process. So the BAC is the Beneficiary Advisory Council, or BAC. It's going to be also selected by the commissioner, consistent with federal rule. It's going to be current and former Medicaid beneficiaries, family members, and caregivers. Again, members going forward in both of these will not be able to serve back-to-back terms, so they'll be on for a period of time, off for that same term, then they could be back on.
And how long are the terms?
So we'll start out with a staggered process. It'll be 2,
Yeah.
3, and 4, and then once everything's up and running, it's going to be 4-year terms.
All right, okay.
So here's a little bit more information about the Beneficiary Advisory Council. 15 members, 10 current or former Medicaid members, 5 parents, guardians, caregivers. So there's currently 3 Medicaid members on the MAC, on the Advisory Council, on the ACM, and then we will be appointing 4 of those other members from the back, so that there will be 7 members on the MAC once that's going. Again, staggered 2, 3, 4-year term process to start out, then 4 years once everybody is appropriately staggered.
And this is by the commissioner, right? The
Yes.
MAC currently is by the governor, right?
Yes.
So that's a change for both. Well, the back is new, but the MAC is the commissioner.
Yes, and yeah, the federal rule was the commissioner appoints. So we have a QR code here that should work. Also would encourage you to go to our Medicaid advisory webpage. You can email dms.back@ky.gov. There's a phone number there. So we're in the process of looking for members to serve on the back. They also can serve on the MAC as part of that back process. So if you're interested, if you know anyone who might be interested, we are really looking for members to participate right now. We're going to be accepting applications through May 29th. Then we will be having everything completed and selected by July 9th. And we'll be looking to have our first meetings in September of the new MAC and back.
And how often do those meet, the MAC and back?
So the back is required to meet before every MAC, close prior to that. So the back is looking at quarterly meetings. The MAC may have to consider quarterly meetings just because of the meeting cadence of the back is going to be a little bit, contingent on.
Because now the MAC meets every other month?
Yes. Yeah.
So they have to make that change.
Yeah, because the way that would look is the back, it may be difficult to ask those members to meet 10 times a year or 12 times a year or something like that.
Yeah,
so
I agree.
So it's that's
going
to be
every month. There'd be a meeting for those dual members to be right.
Yeah. And then here's some information about how the MAC is changing. It's going to end up being 31 members appointed by the commissioner. We have those 5 ex officio members and 205, 540. So, that's the secretary of the cabinet. That's a commissioners of DPH, BDID, I believe Dale. And then there's the 14 members who are appointed by a nominating organization. We have a new MCO position. The MCO position is going to be a little bit different. It's going to rotate every year so that the different MCOs have an opportunity to participate and have representation on the committee. So that they'll rotate a member every year. Then we'll also have our consumer advocates and then the 7 new members from the back. Since we have that 25% back composition rule now, in the future when new people are added to the MAC, whether that's by statute, whether that's by federal rule, whether that's by DMS, we're gonna that's also gonna drive a new composition of the MAC. So we may, if we get over this magic number, we may have to have 8 members appointed from the back.
So the 5 ex officio members don't count in when you calculate the 25%.
I believe that's right. Yes.
Because otherwise you'd have to go to 8 right now if you got
Yeah.
31.
Yeah. Right. So yeah, once we move over that 28
Yeah.
number, it will it'll
Automatically
pick up. Yeah.
initiate another.
Yeah.
Right.
Yeah. So one member to the MAC could end up being 2 members to the MAC for the next next while. Again, talking a little bit here about the 2-year, 3-year staggering, the Kentucky Association of Health Plans, that's the MCO representing body, will have a nominee, but it's going to be someone from the MCOs. Is how we expect that to work. Then a little bit of information about folks who are currently on there and in unexpired terms. They're just going to be automatically appointed. And then if you have folks whose terms have actually expired and they're just continuing to participate, they're going to have to go through a different nominating process. And then again, if you have questions about the MAC, probably likely, and sorry, Aaron, you'll be likely to email Aaron. I know that's how a lot of that will shake out. You can also email KY-MAC-TAC. You can see this QR code here, phone number here if you need to, if you want to try to call as well. That's, I believe our next page is a question page. And if you have any questions, happy to talk about it. Also happy to stop sharing if it's easier for us to talk everything out.
Thank you, Jonathan. Any questions? Will this impact TAC participation?
No, the TACs are not impacted at this point. Obviously, our bandwidth is going to be impacted by working with the BAC, working with the MAC. So, that's something that could play out over the longer term, but just this plan today, moving forward, does not impact the TACs.
So the client needs and consumer rights TAC, I mean, that sounds like a BAC almost, but that will continue.
It will continue to be in the statute, so it can continue. They will that group may want to meet and discuss how they want to move forward. That they may want to move into more of a support role with the BAC, so they're going to have some different options moving forward, I think.
And will there be assistance offered to the BAC? Some members may need assistance with transportation, but facilitating meetings and I guess they're going to be virtual as well.
So that they're going to have the option for virtual, hybrid, or in person, and then we're going to have a level of assistance as well that we offer to them to participate.
I think it's an important thing.
Yeah. Agreed.
And if they don't have the technology to be virtual, could that be made available for them? Laptop or something?
I believe so, yes.
Okay.
This is Erin. I think the thought process is we will work with each individual BAC member on their needs to assess what they need to participate, how they need to participate. I believe on the BAC application, it talks about interpreter services or services you may need. So I think that once everyone is established, they will start talking with those members on what their personal needs are. So I think it's going to be a very individual based versus just kind of as a whole. Sorry, Jonathan, I didn't want to cut you off there.
No, that's
good information.
Very good.
I think that the client need consumer rights have kind of discussed that when some members there may have, a staff person, an assistant coming with them who pays for that person, stuff like that.
Yes, and the TACs are different from the BAC, so there's going to be different assistance requirements that we're going to offer as part of it, just due to the different nature of the two types of committees, councils.
Yeah. Any questions? Thanks for that information. I know people have been wondering what's going to happen. So. All right, folks. Appreciate it. Thank you, Angela. Thanks, Jonathan. Thank you, Aaron. TAC members, thanks for being on. Appreciate it. Everybody else, y'all have a great day. We'll see
Thank you too,
Bye-bye.
Steve.
Thank you, guys.
Everybody have a good
Bye.
day. Thank you.
Bye-bye.